Muted.
Working with people with mental health issues training. This is all about what the transition specialist needs to know about working people with mental health issues. Today we have Laurie Carter doing the training for us. It's very exciting. And she is going to take questions at any point. So if you do have a question, on your dashboard you should be able to see a hand. That means you're going to raise your hand to ask a question, and then I will unmute you and you should be able to speak. We had a few technical difficulties earlier getting this function to work, so if you are not getting a response from being told go ahead, you're unmuted, please just type your question into the question box and we'll be able to read them. So without further ado, Laurie, why don't you take it away?
Okay, hello everyone, and welcome to today's webinar. Today we're going to, like Suzanne said, we're going to be talking about mental health, mental illness, some barriers, options, and ways that we can help to assist the people that we're working with transition back into the community. To start with, before we talk about mental illness, I thought we should touch a little bit on mental health in general. Next slide. When we talk about mental health, we're talking about our emotional, psychological, and social well-being. We're talking about how we feel about our lives, ourselves, our relationships, how we cope, how we manage stress, how we manage the difficulties in our lives. As I'm sure everyone can attest to, the state of our mental health naturally fluctuates. We all experience emotional ups and downs. As they say, life's an emotional roller coaster. If we're coping with the death of a loved one, a divorce, illness, problems with our job or our personal life, we're likely to experience higher levels of stress, anxiety, feelings of loss, being overwhelmed. And on the other hand, when things are going well in our lives, if we were to, say, win the lottery or get tickets to our favorite concert, get a job we really want, then we're feeling much more positive and happy, kind of an on top of the world feeling. So despite these ups and downs, usually we're able to cope and manage with these fluctuations in our everyday life. Next slide. So what is mental illness? When we talk about mental illness, what are we talking about? According to the National Alliance on Mental Illness is a disease that impacts a person's thinking, feeling, mood, and it may affect their ability to relate to others and function on a daily basis. It's important to remember that the term mental illness is a very broad term. It encompasses many different mental health conditions or diagnoses. Currently, I believe there's well over 200 different types of mental illnesses classified. It's also important to remember that the severity of mental illness can vary from very mild to moderate to severe. In that way, it's really just like any other illness. Some people have very mild symptoms, while other people have symptoms that completely overwhelm nearly every aspect of their lives. And finally, it's important to remember that mental health conditions are unique to each individual. You can have two different people with the exact same diagnosis, and it's going to look two different ways. It's very personal. So when you're working with a participant and the nursing home discharge planner says to you, well, Mrs. Jones has mental health issues, it's very important to remember that that could mean anything. It could mean they're a little depressed because they're been placed in a nursing home, or it could mean they've struggled with schizophrenia for their entire life. So it's really important to, to realize when someone says mental illness, it could mean anything on a spectrum of conditions. Next slide. Next slide.
Did I get you out of order, Laurie?
Yeah, you did a little. Okay. So we're on slide number 5. When is something a mental health issue and when is it actually a mental illness?
That
Okay,
one?
that one. There we go. So it's important to look at when a mental health condition is a mental illness and when is it a typical response to, say, a traumatic event in your life. Mental health conditions are not always easy to diagnose. Like we said earlier, almost everyone has mental health concerns from time to time in your life. If your husband, wife, partner dies, you'll probably experience some symptoms of depression. In the same note, if we have a stroke, we lose our home, we wind up in a nursing home, we're also very likely to feel depressed. Both of these instances are very typical reactions to a traumatic life event. However, how do you know when somebody has a mental illness? Unfortunately, there's no simple test that can tell you whether someone has a mental illness or not. It's not like they can take an x-ray and say, yep, you, Laurie, have an anxiety disorder. A mental health diagnosis.
Blood test, Laurie. We could do a blood test.
Excuse me?
I said we could do a blood test.
Yep, you could.
I'm trying to kid, sorry.
Oh, okay. Anyway, a mental health diagnosis is actually a multi-step process. It includes evaluation by a medical doctor because sometimes mental health symptoms can actually be something physically that's causing symptoms very similar to mental health problems. So the first thing you want to do is give the individual a physical, have them have a thorough physical evaluation to make sure there's nothing physical going on. And then they'll also have evaluations from mental health professionals. Again, it's not an easy cut and dry kind of a test that they can do. They look at an individual's symptoms. They're evaluated for how long they are having the symptoms, the frequency, the severity, any social or functional problems that are caused by the symptoms, as well as the individual's ability to cope, the evaluator's observations, and the person's attitudes and behaviors. Next slide. Now this slide shows some common symptoms of mental illness. Now when you read down these symptoms, you'll note that many of these symptoms could also be a typical reaction to a life situation. Many of them are things that we have every day, or we have, commonly to some degree. So when you look at these are some symptoms, but it's not just having the symptoms that determine a mental illness. It's also how the symptoms affect someone's everyday life. So you can just kind of look at some of those symptoms. Next slide. And these are some more symptoms. And again, it's not just having the symptoms. It's a whole process of looking at how the symptoms affect the individual. Next slide. Oh, causes of mental illness. The bottom line is the exact cause of mental illness isn't really known. Most of the time, they're not going to be able to look at someone and say exactly why they have a mental illness. In general, mental illness is thought to be caused by a combination of factors, a combination of biological, psychological, and environmental factors. Most mental health professionals believe that there's a variety of contributing factors, and that it's not caused by any one particular event in most cases. Next slide. Some of the contributing factors include physical factors, like your genetic makeup or your brain chemistry. It might also include family history. According to research, mental illness is more common in family members. It does not mean that just because your mom has a mental illness, you're going to have a mental illness. But it does, research does show that it is more common, and that is an increased risk factor. Traumas to the brain. Again, research shows that traumas to the brain can cause changes in personalities and sometimes can trigger symptoms of mental illness. There are also psychological factors. Experiencing a traumatic event, severe psychological trauma, childhood loss, loss of a parent, neglect. All of those are psychological factors that could contribute to someone's risk of developing a mental illness. And environmental factors, exposure to environmental stressors, nutrition, toxins in your living situation, misuse of alcohol or drugs, again, traumatic experience, prenatal exposure to viruses or chemicals, all kinds of environmental factors. The perfect example, I think, of an environmental factor that we work with all the time is the example of someone who is depressed after they're admitted to a nursing home. And I'm sure when you think about it, if I had a stroke and I was admitted to a nursing home, I lost my apartment, I had no idea how or if I'd ever be able to return to the community, I would definitely be depressed and I'd be anxious. And with people running in and out of my room all day long, I may even be a little paranoid about my belongings, what few I could fit into my room. So the next slide kind of goes over some types of mental illness. As I mentioned earlier, there are many different types of mental health conditions, and we certainly don't have time to go over them all. But I did want to point out some of the specific types that you may see and that are kind of more common for you to see with some of the individuals you're working with. Certainly anxiety disorders, generalized anxiety disorders, panic disorders, obsessive compulsive, and post-traumatic stress. Those are just a few. Mood disorders, depression. There's all different types of depression: situational depression, clinical depression, bipolar disorder, and of course psychotic disorders, schizophrenia, schizoaffective disorder, and trauma and stressor-related disorders, post-traumatic stress, acute stress disorder. And there are many, many more, but those are just to name a few. Now, living with mental illness. This slide really just provides some statistics that I thought were really interesting. When I looked at the website for the National Alliance on Mental Illness, NAMI, they're called, they have some very interesting information. And one of it is that approximately 1 in 5 adults in the United States, that's over 40 million people, will experience some form of mental illness in a given year. So if you look at your office and you have, say, 10 people in your office, then 2 of those people during the year are going to experience some kind of a mental health crisis. Maybe they'll have a period where they're really anxious about something, they're depressed, maybe it's something more severe. 1 in 25 Americans live with a serious mental illness, and that's a lot of people. Most individuals with mental illness can and do live in the community. These people are our neighbors, our friends, our co-workers, and ourselves. So most people with mental illness live right in the community. Some people can manage their situation and their mental illness very easily. Others struggle their whole lives to manage. And that's kind of where we come in. If we can address some of the struggles and assist people in addressing those needs, then they're going to be more likely to succeed in the transition. The other thing I want to point out on this slide is that even though someone has a mental illness, it isn't necessarily a barrier. Some people that we work with in a nursing home have had the mental illness their whole lives. They're used to dealing with the mental illness. They may be in the nursing home because they had a stroke or because they fell and broke their hip. It may not have anything to do with their mental illness. Their mental illness may be exacerbated because of their situation, but there's also a number of people that their mental illness doesn't have anything to do with why they're in the nursing home. So that's important to look at too. How did they get there? So slide 12. Why is the ILC philosophy a perfect match? I really think that the ILC philosophy that we all work with, both as Open Doors staff and as ILC staff, is especially well equipped to work with people struggling with mental health issues. Through the ILC philosophy, we have a person-first perspective. We're working with people. We're working with the person, not the illness. A person is not a bipolar. They're someone who has a bipolar disorder. We look at what the individual can do, not what they can't do and not what they might not be able to do, but what they can do. We also have access to information regarding all of the resources in our specific communities. We know the people in our communities. We know where to ask and how to get that information. We're focused, we're person-focused, ability-focused, and solution-focused. And all those things, I think, are a perfect match with working with individuals who struggle with mental health issues. So what does the transition specialist need to know? We're going to review now some of the specific things that hopefully will be helpful to you as a transition specialist. So how do you know if somebody has a mental illness? Sometimes you meet with someone and you can kind of get an idea, yes, they have a mental health problem, but other times you have no idea. So how do you know? The first tool that you have, and I think the most important to find out if someone has a mental health issue, is to ask. Next slide. The first suggestion is really easy. Just ask. You'll be surprised how much information people will share if you just ask them. You can't ensure somebody's mental health needs if you don't know they exist. So it's okay to ask. This is easy for some people, and it's not so easy for others. It took me many years to feel comfortable asking people all these questions I ask. But the more you ask, the more you'll find out. In my opinion, there are two questions as a transition specialist that you should be asking every single active transition that you work with. And the first is, why were you admitted to the nursing home? What led to your admission? Or something similar to that. Basically, what you're asking is, why are you here? What led you to become a nursing home resident? And I can almost guarantee you when you ask that question, they'll tell you probably more information than you even need to know. It really opens up the doors. And after they tell you how they came to become admitted into the nursing home, the next question is, why are you still here? What is it that's keeping you here? And you'll find out what their perspective is of why they're there. I don't have housing, or I don't have a support, or maybe it's something else. But you'll get their perspective of why it is that they're in the nursing home, and that's important. And in terms of finding out if someone has a mental health issue, you should also be asking, do you have a history of mental health issues? Have you struggled with depression, anxiety, panic attacks, anything like that? Are you currently experiencing any mental health issues? If they say yes, just simply ask them to tell me about it. Tell me about it, Mrs. Jones. Tell me about your depression. How is that affecting you? Are you on any medications for that? Have you ever received treatment? What kind of treatment? Did you go to see a counselor, a psychiatrist, a day treatment? Have you ever been hospitalized for mental health issues? When? How long? How long ago? Maybe it was 30 years ago and it has no bearing on today. And a very important question is, have you had these issues before you came to the nursing home? This is important, again, because sometimes mental health struggles are situational. People are going to have some of the symptoms of depression, anxiety, all of these things. So you want to find out, did the person have these issues before they came to the nursing home? Were they depressed before they came in the nursing home? Maybe they've struggled with this their whole lives, but maybe, like in our example of the person who'd had the stroke and was admitted into the nursing home and is now feeling depressed and anxious. Maybe this is due to their current situation. And a final important question is, how did you manage this illness? If they say yes, they've had mental illness, how did they manage it? They could have managed it in the past very well, and that's a good indicator. If someone says, oh, you know, I've struggled with this my whole life, and I've been, you know, homeless, and I've had, you know, a dozen different programs, and that's a very different scenario than someone who says, yes, I've struggled with this, and, you know, I went to a counselor and a psychiatrist, and I was fine for 30 years. That's a very different, and those people will have very different needs. And the reason you're asking all of these questions is so that you can determine what their needs are and help them to find the supports for those needs. Another tool that we have that we can utilize to determine if somebody has a mental health issue that we should be addressing is the history and physical.
Laurie, can I interrupt you for 1 second?
Sure.
That you brought up a really good point in saying that some people may be less comfortable asking these kind of questions, and that if you bring a printed form that has the questions on it, sometimes it can just be more comfortable to read questions off of a form than it is asking them in the course of a conversation, because you're kind of, the reason you're asking it is because you're reading it off the form, and it kind of takes the pressure off. And I think you also make a really good point that the reason that you're asking these questions is not because you have some, curiosity, oh, who has mental health issues, who doesn't. It really is all about being able to plan for someone going back to the community, and that's really the only reason that you want to know, is that if there's something that you need to make sure is taken care of, you need to know about that.
And in my career, I've often told people that if they seem a little bit, taken back, or why am I asking this, I tell them, because I want to make sure that I'm assisting you the best possible way that I can. And to be honest with you, people rarely ask. I think people are very used to being asked a million questions by the time they're a resident of a nursing facility. Fortunately or not fortunately, I think that's the case, and I think Suzanne's right. If you bring a list of your questions, that's helpful. The other thing is, if you're not comfortable asking questions, just force yourself to ask some of these questions. You're asking with empathy, and they're going to know you're asking because you care. And I think I can say that about everyone working for us. So if you just kind of push yourself a little bit, and like Suzanne said, bring a list of questions, sometimes that helps. So back to the history and physical. The history and physical, each resident in a nursing home has a history and physical evaluation on file. Actually, if you go to your doctor regularly, you have a history and physical on file at your doctor's. But in a nursing home, when someone comes into the nursing home, when they're admitted, they're usually admitted with a history and physical, or it's done shortly thereafter. And this goes over their diagnosis, their medications, treatments, family history, social history, as well as the individual's treatment, medical treatment. If somebody has a mental health issue, it should definitely be listed on the history and physical. It doesn't mean that it's a surefire tool and it's going to be, but it really should be. And a lot of times I'll read history and physicals and I'll be surprised what I find. Sometimes people don't mention a lot of things because to them it's, you know, they don't look at it like that, or it's not a big deal. So that's another tool. If you can ask the request a copy of the history and physical, that can be a very good tool. Another tool is the medication list. You can look at a list of someone's medication, and by becoming familiar with some of the more common medications that are used for major mental health issues, it can kind of be a trigger, a red flag, if you will, to look into why someone is on that medication, if it is indeed to treat a mental health issue. That being said, there are many, many different kinds of medications, and I'm not suggesting by any means that you become an expert on meds. But I think the more you look at meds, the more familiar you're going to be with them. And if you see a medication that's usually prescribed for a major mental health problem, you might want to ask a few questions about that and look into that a little bit further. One of the things, though, to be aware of is that a lot of times medications are used for different things. You might be, for example, you might be given Wellbutrin to treat depression, or you might be a smoker who's being given Wellbutrin to help you stop smoking. So sometimes they have no correlation to a mental illness, but many times they do. And like I said, it's really just a trigger to ask some more questions to see if they have any mental health needs, which you need to be aware of to address any issues and make their transition as smooth as possible. This aspect is also a really good time to utilize our nurses, Laura and Christine. They know, they have a wealth of information about medications, and I'm sure can answer any of the medications that you have. Now, this slide with all of the medications, too, I want to just point out that this is really a partial listing of medications. It's by no means it's not a total listing of medications. It's really only a partial listing. It's a very, very few. They have many, many medications. But these are some that, like, I'm familiar with, and some that that I think are commonly prescribed. So another tool that can help us to determine if somebody has a mental illness is a PRI and a screen, a patient review instrument and a screen. If someone has a mental illness, it should be listed on the PRI and it should be addressed on the screen. The PRI, now just to let you know, there is a whole training on PRIs that we have on file. So I'm not going to go over PRIs in detail, but like I said, the main thing is that a PRI is an assessment tool that is given to individuals when they enter a nursing home and periodically thereafter. They use it for a level of care, to determine someone's level of care. They also list the person's medical conditions, treatments, medications, special diets, all of those types of things. Along with the PRI is the screen. The screen is an evaluation. It evaluates whether an individual who is seeking admission into a nursing home has a mental illness or an intellectual disability or a developmental disability. If, when this screen is done, they do have any kind of a diagnosis that they feel or symptoms that they feel they may have a mental illness or developmental disability, then they do a more in-depth screening called a PASAR. Next slide. The PASAR, I kind of just want to point out that the PASAR is the process that nursing homes use to make sure that a person is appropriately placed. This slide reviews the process. The first step is that the level 1 screen is completed, and if there is no evidence of mental illness, then it ends there. If there is evidence of mental illness, then a level 2 PASAR, pre-admission screening and resident review, must be completed. So anyone who has a serious mental illness should have gone through this process. And this process the nursing homes use this process to make sure that the person's needs can be met in the facility. So if someone has a major mental illness, they will have a level 2 screen or a PASAR, and that evaluation will tell them whether they can stay in the facility and the facility can meet their needs, or whether they can't. So anyone who has a major mental illness should have gone through this process and should have been deemed okay to remain in the nursing home. The nursing home was decided that the nursing home could meet their needs. Another tool that we have to determine if someone has a mental illness that we should be addressing is the UAS, the Uniform Assessment System. And the UAS is a comprehensive assessment instrument for home and community-based programs throughout New York State. The UAS evaluates an individual's health, their strengths, their care needs, preferences, level of care. It guides the development of long-term care plans and services. It helps to ensure that people are getting their needs met in the right place, in the right setting. And under the UAS, the whole idea of the UAS was that it's comprehensive and that many different programs are using the same assessment, so that we're not all doing our own assessment and then each agency does their own assessment. It's a way to do one assessment and have many different programs look at that assessment. As a transition specialist, you don't have direct access to the UAS, but if a UAS was done, certainly the service coordinator, if you're working with the waivers, has access to it, and some other folks as well. And I definitely did want to mention it because it is a tool that is used very widely throughout programs in the community. Okay, so now we know that someone we're working with has a mental health condition. What are some of the barriers that we face? And I think you guys probably could rattle off quite a few barriers just through your experiences that you've had. And by identifying some of the barriers, it helps us to identify some supports that may be needed to assist the person in being successful in the community. And in my opinion, the biggest barrier that people with a mental health condition face is stigma and issues related to stigma. Despite efforts to overcome it, having a mental illness can still carry a very negative stigma, which can have profound implications to people in their every aspect of their life. Unfortunately, negative attitudes and beliefs towards people who have mental health conditions are common. Sometimes people are reluctant to seek mental health treatment or to continue mental health treatment because of the negative stigma. I can't tell you how many clients, how many consumers I've had in my own personal career that have said, I don't have a mental health problem, I'm not crazy, I don't need help. And you know, they don't necessarily say that to me when I see that their leg's swollen and they need to go to the doctors to find out what the problem is and to get treatment for it. I think people who have mental health issues have to deal with a great deal of stigma that can definitely be a barrier. Sometimes there's a lack of understanding from our families, friends, and coworkers. How many times have you heard people say, just snap out of it? Pull yourself up, just do it. All of those kinds of things are not helpful to someone who has a mental health problem. They can't just snap out of it. And yet these are things that they have to deal with. Also, depending on the individual, and the mental illness in their particular situation, there's also barriers of refusing treatment, discontinuing treatment, possible reluctance to follow the medication regime that the doctor recommends. Depending on their mental illness, they may have interpersonal relationship problems, problems with the landlord or neighbors. People may not understand. They also may have difficulty managing their living tasks, remembering to pay the rent, remembering to go pick up their medications, all different types of things. And of course, a lack of supports. And again, if we can identify the barriers, that's the first step in setting up supports to address the barriers. So is transition possible for people with a mental health problem? As long as the individual's needs can be met, transition to the community is definitely possible. What you do is you just use the same initial process you use with any other individual that you're working with. You determine what the individual's needs are. You determine the type of formal supports that they need. You access the types and systems, and level of informal supports. What family and friends do they have? And are they open to services? That's a really important issue as well. You and every person on the team could believe firmly that mental health services are needed. But if the person does not want them, you cannot force them to take them. It is their right to say no. You can encourage them, you can educate them, you can talk to them, you can beg them, but in the end, it's their call. And as long as the discharge is safe, more or less as long as it's safe, and there are no glaring red flags, the person has the right to say no and still return to the community. I've worked with many people with mental health issues in the community who I wasn't sure how they were managing, but they were managing. And of course, kind of on the flip side of that, depending on the situation, refusing treatment. If someone says, if you as a team say to someone that they need case management, or they need, the services, mental health services, then, and they say, no, I don't want them, then they may not be able to get the services that they need in the community. The waivers, for example, if someone has a mental health need, the waivers want to know that the person is safe to live in the community and that their needs are met. And if they have a major mental health issue and they don't want mental health services, then there's a good chance the waivers are going to say no. We don't feel that that's a safe discharge. And the same with MLTC and CD Pass. So it's kind of a fine line, and it's really subjective. The bottom line is the person needs to be safe. And like with many of our other people who don't have mental illness, that's a judgment call, and that can be a tough one.
Laurie?
Yes.
Nikki has a call. I've unmuted her. She should be able to ask her question now.
Okay, Dickie, go ahead.
Dickie, can you hear us? All right, Dickie, I'm going to ask that you just write your question in the question box. As I said before, we seem to be having some technical difficulties with the mute-unmute. On my end, I'm showing you as unmuted, so you should be able to talk, but I'm not hearing you. So if you ask the question, then I'll just break in for Laurie and ask the question for you. Okay, Laurie?
Okay. So what mental health services does the individual need to go back into the...
She typed it in. Here we go. So she says, for example, a consumer with a mental health issue might say, I want to return to the community, but her family does not support it.
Well, people have the right to return to the community with or without their family support. The problem is that many, depending on the person's situation, many times the services that they need will want a backup, especially if they have physical needs. If they have physical needs, which many of the people in a nursing home that we would be working with, physical needs and mental health needs, if they don't have a backup, it adds to the complexity of things, because many times the waivers want a backup for safety reasons. Many times MLTC wants a backup for safety reasons. But if the person's needs can be met in the community, they don't need their family support. That's the same as with other individuals with physical disabilities. The problem is in getting the services that they need. Hopefully that helps to answer the question.
Yes, thank you, Laurie.
Oh, you're welcome. And feel free to call me after this on any issue at all, and I'm happy to help any way I can. So what mental health services does the individual need to manage in the community? When you have someone who has a mental illness, a mental health condition, you want to make sure that they have all the services that they need. Transitioning is stressful in any situation, but if you have a mental health need, that's one of the things you definitely want to have addressed. So some of the common kinds of services are case management services on differing levels, psychiatry services, and remember the psychiatrist many times is the person who's writing the medications for mental health meds. Sometimes a primary care will, but more and more they will not. So many times somebody has to see a psychiatrist to get their mental health medications as well as review their general status. Counseling or clinical services, they have group programs, they have day programs, they have housing programs. There are many different types of programs, and these are just some of the typical services that someone with a mental health condition may have. Now, what are the options? So you've met with your participant. Next slide. You've met with your participant. You've determined that they do have a mental health condition. You've assessed what types of things they might need and what supports they may have. What are your options for services? What are those options? And there are some options for individuals. And that's what we're going to review next. The next few slides will review these possible options: the waivers, NHTD and TBI, MLTC, health homes, and Office of Mental Health Services. So we'll start with the TBI and NHTD waivers. Just because a person has a mental health diagnosis does not mean that they can't use the waivers. Depending on the person's needs, you can definitely have a mental health diagnosis and be on the TBI or the NHTD waiver. There are many people who are on both waivers who have a mental health condition. Many people who are on the waivers have their mental health needs met by going to outpatient mental health counseling. They need the waivers for their physical services, for all of the different services that the waivers provide, and they happen to also have a mental health condition. And their mental health condition is such that it can be met through going to outpatient mental health services. I've had many people on the waivers who've gone to counseling, who's gone to had regular visits to the psychiatrist, who've gone to day programs or drop-in programs, I should say, and we're still on the waiver. It all depends. The thing to remember is the person's needs have to be met, including their mental health needs, their physical needs, their safety needs. And as long as all of those needs are met and can be safely met within the community, the waivers may be an option. It's not going to be an option in every case, but it certainly could be an option and is something that you should look into. The next option is MLTC. Now, MLTC can also be an option for individuals with long-term care needs as well as mental health needs. You simply follow the same process you would with anyone else. The one thing that I would add is if someone has mental health needs and you go through the process of you know, going and getting the assessment from excuse me?
From Maximus?
Yes, Maximus. I couldn't think. From Maximus, and then you're interviewing. You've called for evaluations by different MLTC providers. You want to ask them if mental health services are provided under their plan. When I did my research for this webinar, some of them do have mental health services under the plan, and some don't. So if they do have mental health services under the plan, you want to ask, what are those services? You know, what are the parameters of those services? Do they have restrictions on who, you know, who's covered? If the person has you know, already a psychiatrist they're working with, you would want to make sure that they're covered by that plan, if possible. And you also want to ask them, what's the process to access them? It'd be nice if I could give you one process for the whole state, but unfortunately, I'm not able to do that. So the best thing is to just ask them. If they say yes, it is covered, then ask those additional questions and ask them what the process is to access these services, so you'll know that. Sometimes mental health services are not covered through the MLTC plans, and in those cases, they're usually covered under the Medicaid state plan. And you would set it up similarly to how you would set it up for the waivers. You would just set up whatever services they needed, if it's counseling or psychiatry services, in addition to the regular managed long-term care services. Now, the next option that some of you are familiar with and some may not be are health homes. Now, health homes are not a residence. They have nothing to do with where someone lives. Health homes are a program. They're a program for Medicaid recipients who have complex medical, behavioral, which includes mental health, and long-term care needs. So this could be an option for your participants with mental health issues, but it could also be an option for individuals who have complex medical needs as well. And the idea of the health home program is to ensure that participants are receiving the specific services and care that they need to maintain and improve their health. They want to provide them with the services they need so they can be healthy, remain in the community, and out of the hospitals and the ERs. The services provided by health homes include care management, health promotion, patient and family support, referrals to community services. Now the next slide is some more information on health home services. In the health home program, each participant is assigned a care manager, and that care manager oversees their care and their services. This includes things like coordinating their health care providers, their mental health providers, substance abuse providers, making appointments, assisting people locating housing, making referrals to food stamps or any other social service, SNAP, Medicaid transportation, HEAP, or other social services, looking at community programs that might help the person, and in some cases transition assistance. To be eligible for a health home, that's the next slide. Someone needs to be Medicaid eligible or have active Medicaid, 2 or more chronic conditions, 2 or more chronic medical conditions, or one single qualifying condition of either HIV/AIDS or a serious mental illness. So if someone has a serious mental illness and they have Medicaid and they need assistance, they're at risk. You also have to be at risk, you know, so that you would need to have services to assist you in reducing that risk. And if you meet those criteria, then a health home may be a possibility for you. Now, whether or not someone who has a health home is eligible for the MFP program would depend. If some health homes, again, in doing research for this webinar, some health homes are covered under MLTC plans. And I would think if the health home is covered under MLTC and you're not receiving a duplicate service, then it might be eligible for MFP open doors. We'd have to look at it. So you can let us know if you have someone who you're referring to a health home. And we can look at whether or not they would be eligible for open doors. In some cases, they would not. You cannot be on the waiver and a health home because it's considered a duplication of services. It's close. They provide some of the same services. I think the waiver services have many more additional services, but it is considered a duplication of service. So you cannot be on the waiver and in a health home. As always, you can provide assistance whether or not they're eligible for open doors. And the best advice I can give you, too, is to contact the health home program in your area. Health homes are located, as all of these different options are, across the state. But it does differ a little bit from area to area. So I would strongly encourage you to call your program and to discuss the services that they have in your area. And I'll have all of these resources at the end of the presentation. Now finally, I want to go over a little bit OMH services and SPOA. The New York State Office of Mental Health, or OMH, is really a large, multifaceted mental health system that services more than 700,000 people a year. OMH services are specialized services for people with mental health problems. These services, it's a wide range of comprehensive services. Some of the services can address issues that are in severity are very mild, as well as situations that are extremely complex and very severe. They have residential treatment programs, day programs, case management, housing, clinical treatment, vocational programs, recovery programs. Through OMH, an individual can receive, they would be assessed and they can receive mental health treatment in all of these areas. Now, to ease access into the OMH system, to ease access into applying for mental health services, they designed what's called a single point of access, and that's referred to as SPOA. This is across New York State. This is the next slide, Suzanne. Now, I'm sure many of you have heard SPOA. SPOA is not a program, it's a way to access programs. It's single point of access. It's designed so that you can easily access or somewhat more easily access services under the Department of Mental Health. The referral form can be found on the Office of Mental Health website. When someone puts in a referral, these referrals are reviewed by a team of providers in your area, and they review the person, and they would help to link the person with the program that will best meet their needs. They meet every couple of weeks, and they do this regularly. I had an in-depth conversation with the woman who runs the SPOA program in the Albany area, and she was very helpful and very informative. And depending upon the services that the participant needs, again, they may or may not be eligible for the Open Doors program. If someone needs a service through OMH that is for a major mental health service, they may not be eligible for our program. We do not work at this point in time with OMH programs. If all someone needs is counseling or psychiatry services, they can still go through a SPOA, or they can just apply to the clinic or the the office of you know, their choice in their community. So again, it depends on the situation whether or not they would be eligible for open doors. And as always, you can still provide assistance or guidance whether the individual is eligible for open doors or not. And if you have any questions on that, just feel free to call us. But this is definitely many services are offered under OMH. And finally, things to remember. Individuals who experience mental health conditions can and do transition back into the community. Just remember that there are additional services and supports that are needed and that should be arranged to help meet those needs. The important thing is to identify the needs and to offer services to help to meet those needs. I encourage you to contact your local mental health resources. That's the best way to determine what the specifics are on the programs in your area and how to access these services. And feel free to call us anytime. We're certainly happy to provide ideas, suggestions, assistance, you know, help any way that we can. Now, the last slide are the mental health resources. If you don't do anything, go to the Department of the Office of Mental Health Resources website. I have it on there. You can cut and paste, and they really have a lot of information. They have a site. They have a link to all different types of mental health disorders. You can click on the link and you can pick whatever disorder your participant has and find some information under it. You can also find information under any variety of topics. You can find information on mental health programs. There's a county directory of mental health services, so you can find out what in your county, what services are out there. Some of them you may know, and some of them maybe you don't. So I thought it was very informative. There's also a local website of mental health directors, and what that is your local Office of Mental Health. And you can look on their website as well. They're on this list of resources. There's a listing of mental health programs by county, SPOA contacts if you want to access your Office of Mental Health Services. Then there's that website, contacts by county. There's also the universal application, which isn't necessarily an easy application, but it is there, and it is a good way to start. The next slide, more resources. There's a link here for information on health homes. This first link is a brochure about health homes, just general information about health. And the second is a list of health home contacts by county, so you can look up who your health home contact is. And I also put on here the website for the National Alliance on Mental Illness. This I thought was really informative too, and very interesting. They had a great deal of information.
Well, thank you, Laurie. That was really a lot of information, very helpful. Does anyone have any questions? You type them in. But I think what Laurie's main point is that you know, just because someone has a mental illness does not necessarily mean that we're not able to help them. There's a lot of things that we can do and to help them leave the nursing home. So, and I know we're right on our 3 o'clock mark here, so if there are no other questions, I'll thank everyone for participating, and I will send out a copy of this PowerPoint, and the PowerPoint will be available on the NYAIL website for anyone who is not able to attend. Again, thank you very much, Laurie, for a wonderful presentation.
Oh, you're very welcome, and feel free to call if there's something you want to talk about in more detail or something that didn't make sense. Feel free to give me a call.